Good evening, everybody. Tonight our discussion is going to be on the AANP versus ANCC examinations for FNPs and AGNPs and how to decide which test is right for you. When I was going through and vetting members for this page, I saw a lot of people who were undecided or maybe wanted to take both, and then some who had already definitively picked the test that they're going to take, and that's great. So I'm here to help out those of you who are undecided or maybe we're taking both and maybe help you just pick one so you don't have to spend as much money. So again, we're going to break down AANP and ANCC as detailed as we can get. All right. So we'll start with discussing the AANP. So the AANP costs about $315. Members pay about $240 in comparison to the ANCC, which costs $395. And ANA members pay about $295. So if you're looking for a cheaper option, AANP is cheaper, so that's one of the pros and cons. AANP is cheaper, ANCC is a little more expensive. On the AANP, there is 150 questions. 15 of those are like questions that are being tested out to see if they will work for future tests as far as format goes or content, etc. So you actually are tested on 135 questions. On the ANCC, you have 175 to 200 questions. 25 of those are not counted. The AANP, it takes about 3 hours. That's the max amount of time you're given, or 180 minutes. So that's 150 questions in 180 minutes. So you have more than a minute for each question. The ANCC gives you about 3.5 hours. So that gives you about 210 minutes. And you can have up to 200 questions, so I feel like there's a little bit less time per question on the ANCC. But again, you could have as few as 175, and again, 25 of those are not counted in your final score. Okay? So that's just kind of some basic stats about both of them broken down. Now I'm just going to go through the rest of the information about the AANP, and then we'll go through all the information on the ANCC. So the AANP, it's updated yearly. And it is updated in January or February, depending on the year. This year, I updated it on January 2nd. Rumor has it that there's 2 formats of the test per year, so you could get either one of those. You need a 500 out of 800 to pass. It is called a scaled test, so that does not mean you need 500 out of 800. Like, divide that and find your percentage. That is not what that means. What you actually need to make is about a 70%. So think of that in your head when you're doing your practice questions. And that's true for both the AANP and the ANCCs. You need to be hitting about 70%. Your question format on your AANP examination, most of it is just plain old multiple choice. You can have multiple choice with multiple response. I don't personally remember having any on my boards during 2018. And you can have up to 1 EKG or 1 chest x-ray. I had neither on my boards, but it is possible, and it's on their outline, that at any given time they can add 1 EKG or 1 chest x-ray to the AANP format. The content breakdown for the AANP, it's broken down a lot differently than the ANCC. So I've included links to that as well in the feed up there. So you got your ANCC content outline and your AANP content outline, because they are broken down so differently. So the way that AANP breaks itself down is into 4 separate categories. It's got 2 domains and then categories under each domain. So domain 1 is broken down into assess, diagnose, plan, and evaluate. So it's very heavy in assessment. So 36% of that test is assessment and your ability to pick out subjective and objective data that's pertinent to the patient themselves. Then 24% of your questions are on diagnosis. So you're trying to find your differentials, and then you're trying to properly diagnose patients based off of the scenario that you're presented with. The next category is plan. About 23% of the test is planning. This includes pharmacology, diagnostics, follow-up, and referrals. And your evaluation only comes to about 17%. So that would be like outcomes and adjusting therapy and deciding if they've been seen too many times and need to be referred out. So what I would take away from that is if you're really strong when you're doing your, like there's that Pocket Prep app, it breaks you down and lets you know which categories you're doing poorly in. A lot of the predictor exams will let you know which category you need the most work in. So if you're doing really well in assessment, great, that's like 36% of the content. If you're doing bad in evaluation, that's not detrimental on the AANP because it's only 17% of the content. So keep that in mind when you are doing your practice questions, you know, on something like FNP Pocket Prep or something like that, one of those apps. It's also broken down in Domain 2. It's broken down by age. Okay, the ANCC does not. They have something kind of similar to Domain 1, but they don't break it down by age like the AANP does. So prenatal questions only make up 3%. There's like 4 questions on prenatal stuff. So keep that in mind. Pediatrics is about 14%. Teenagers are about 18%, which just means the content of the question doesn't have to necessarily be teenage specific, but the question is going to be about a teenager. So it could still kind of fall under pediatrics, but it could be something more like Tanner stages or development, or things like Osgood slaughters, things that are more commonly seen in teenage patients versus, you know, children and preschool age children. 37% is on adults, 21% is on geriatrics, and 7% is on the frail elderly. Okay, now they do not specifically give you the age, and they make that very clear. They're like, we don't have exact age range for these groups. So in my mind, I kind of group all the adults together and see that like 65% of the test is on people that are older than the age of, you know, like 18. Okay, so that's a lot. That's a lot. That's very heavy on that. Now, there's no way to really compare that to the ANCC because, again, it is broken down so much differently, and they don't break it down by age group. So AANP is 100% clinical content. Okay, there is no research, there is no policy, there's nothing about Medicare, Medicaid, insurance, all that kind of stuff. If you were to ever fail the AANP, you can take it up to 2 times per calendar year. So it's not per 12 months, it's per calendar year. So if you took it in March, you can take it again in October, but you can't take it again for, you know, till next January. And you must do 15 continuing education units in the category where you did not do well, whether it was assess, diagnose, plan, or evaluate. They recommend that you do your continuing education in those categories. If you decide to withdraw from this test and change your mind and decide you want to take the ANCC, or you signed up for both, took the ANCC first, passed it, and now you want your money back, what are you going to get? You're going to forfeit about $120 because that's their fee that they're going to keep, and then they'll refund you the remainder. So if you paid full price, you're not a member of the AANP, you would get, you know, about $200 back. If you were a member, you get about $120 back. But they're going to keep $120 regardless of what you paid. So if you withdraw, change your mind, switch tests, of course you can reschedule the AANP as long as you do it 48 hours in advance. So like I was scheduled to take it on a Friday, and I decided I wanted the weekend to just kind of relax and get my mind wrapped around everything, and I just rescheduled it and took it on Wednesday and was fine. And, you know, no problems, no penalties, anything like that. Okay. So the ANCC, again, the question format here is going to be a little bit different. So again, on AANP, it was multiple choice. Like all of mine were multiple choice, 100%. But it says you can get multiple choice, multiple response, or an EKG or chest x-ray. On the ANCC, it's a bit different. Okay, you can get multiple choice with multiple response, drag and match, which I've heard there are a lot of those. Hotspot photos, which that would be like, so they show you the picture of the abdomen and say, okay, the gallbladder, you're having rebound tenderness with gallbladder, or Murphy sign, or Rav Singh's, or whatever, and they would say, where would you point, you know, what would you push on, and you know, click on that area. So that would be your hotspot. They have pictures of eye and skin conditions. So if you're going to do ANCC, make sure you're strong in the derm section, and as well as eye infections, things like that, and your fundoscopic examinations. Review that. So don't just know descriptions of your dermatology. Make sure you've looked at pictures and use visual aids. And they can have simple EKG strips. Simple, very simple. They can't be like bundle branch blocks or heart blocks or stuff like that. And you can have 1 chest x-ray. That's the max number of chest x-rays that you can have. So if you're bad at it, don't stress so much because, again, it's only 1 question if you do even have a chest x-ray. But usually it's something as simple as a lobar pneumonia, something like that, cardiac enlargement. So don't stress about the chest x-rays. Don't learn every single thing there is to know. Pass rate, we'll skip that. We'll come back to pass rate at the end because that's contested. So the content breakdown, again, is very, very different. It's not broken down by age group. It is broken down by 3 categories. And then each one kind of has a description of what falls under that category, okay? So our first category is Foundations of Advanced Practice. This is 37% of the examination. It includes pathology, physiology, pharmacology, health assessment, research methods, and informatics. Okay. The next category is Professional Practice. That's about 17%. Leadership, advocacy, collaborative practice, quality improvement, safety, economics, and policy. Okay. Next one is the individual practice, which makes up 46%. And this includes a lot of what you think of as like clinical content. So health promotion and maintenance, illness and disease management, care of diverse populations, evidence-based practice, diagnostic reasoning, and critical thinking. All in all, it comes down to about 50% clinical and 50% non-clinical. So if you feel like you're, in school, you really did well on the clinical portions, in your classes like Path and Pharm and Health Assessment, and your final like total management classes, that's going to be the test for you. If you feel like you had a really good ethics class or really good policy class, maybe the ANCC is more likely for you. Okay. So what happens if you failed the ANCC? You can take that one 3 times per 12 months. Okay, because this one only updates every 3 to 5 years, so they don't really care. So you can take it within the 12-month period. So you could take it March, April, and December, but then you could take it again in March, because then your 3 would be up. Okay, you must wait 60 days between. There is no continuing education. So if you want to change the test, you can withdraw. You will forfeit $140. Okay, so originally this one was $395. You will be given about $255 if you did not use a discount. You'll get about $155 if you did do a discount. So the pass rate is another big question. So in 2015, 5% more people passed the AANP than the ANCC. In 2017, that wasn't exactly the case. In 2017, the pass rate for the AANP F&P examination was 80%, and for ANCC, it was 83%. So in 2015, it was flip-flopped. More people passed ANPP, but in 2017, more people passed ANCC for family nurse practitioner. Note that, because it switches. Okay, for the AGNP, 82% passed the AANP, whereas only 76.8% passed the ANCC. So more people passed the F&P examination for ANCC, more people passed the AANP for the AGNP. All right, and that seems to flip-flop year by year, so I wouldn't let that be my deciding factor on which one that I took. Okay, so then what do I let be my deciding factor? Okay, why did I pick AANP? I picked AANP because I love clinical information. I really thrive on that kind of stuff. I don't really pay attention as much as I probably should to policy and Medicare and Medicaid and all that kind of stuff, because my end goal in my personal career is to open a retail clinic that doesn't include insurance. So in my mind, it was a waste for me to sit down and learn this is exactly what Medicare does, this is exactly what Part A, B, C, and D does, and all that kind of stuff. So that's kind of why I picked AANP. Another thing that I often hear is, I've heard that different hospitals prefer different ones. Not true anymore. Both are highly respected credentialing boards. There is no reason to take both for fear that a hospital system will not hire you. If you've heard of a case of that, please let me know. But to my understanding, that is no longer the case. If you're moving to a different country for some reason, and you know that different countries prefer one over the other for whatever reason. I think it originally started out, all this confusion started off because the VA would only accept people who had ANCC for several years after AANP kind of became a foundation. So I think that's where it kind of came from, but now the VA accepts both AANP and ANCC certified nurse practitioners, so that's not a good reason anymore. I see a lot of people who signed up for both. Again, if you want to take both for knowledge sake, that's fine. If you want to, maybe you signed up for both because you're worried you're going to fail one and you want to take the other one, already be signed up because you have a job waiting on you. I understand that. So I just don't want you to spend money on taking both if you don't have to, because don't feel pressured like you have to take both. That's kind of the biggest thing I'd say, because I saw so many people say that they were going to take both of them. And I'm really curious, to see what some of those people reasons are. Some people's reasons, because I did ask a few people, and they were like, oh, I'm moving to Canada, and I know that, you know, this country's going to want this one. And that's great. That's fine. But again, if you're doing it for knowledge's sake, great. I want you to be confident going into these tests that you're going to pass them. I don't want you to feel like, oh, I have to sign up for both because I'm so worried I'm going to fail one. Your goal, as far as, you know, being a part of the Fast Lane group, is that we get you ready for one examination. You go take that exam, and you don't have to worry about signing up and paying for two. But again, I did go over how much you can get back if you do withdraw from an exam, so that you can kind of keep that in mind if you're doing kind of like a cost-benefit analysis. I have a question down here. Do you have data regarding how many people tested for the AANP versus ANCC? I actually did run into that while I was looking at things. So, of course, I have a 1-year-old son who knows where those sticky notes went. She's 18 months, so she walks and moves everything. So, Nikki, I will type that in for you, because there was a lot less people take the ANCC versus the AANP. I'll say that much. When I was looking at it, it looked like there was less ANCC versus AANP. And again, the reason I didn't really want to do ANCC is because I didn't want to learn all that non-clinical information, because I felt like I didn't really get a lot of it in school, and I knew I would have to work really hard to learn all of that, where I felt like my program did really great in preparing me for clinical stuff. If you do want to do the ANCC, my biggest recommendation is Leek's book. The last like 4 or 5 chapters of that book are spot on. They have exactly what you need in them to memorize. It is a lot of rote memorization as far as that content goes, whereas the other clinical information is a lot more critical thinking. So sometimes people pick that because it's more like memorization versus critical thinking. So if you want to just have some memorization stuff, you're really good at that, maybe ANCC is a little bit more for you. So again, if we don't have any more questions, I think that concludes it for me tonight on the breakdown of those. If you got here late and missed part of it, just go back to the beginning and get a good recommendation, a good review of both of the tests for you to decide. Again, both of these are great tests. Both of these are, you know, going to assess whether you're ready to start, you know, practicing. And both of these are going to be accepted by any hospital system or private practice. And, you know, you get to be your, you know, if you pass your AANP, you'll be your good old FNP-C. If you pass the ANCC, you'll be an FNP-BC. All right, and so I look forward to seeing those credentials behind your name soon, okay? If you guys have any questions for me, you can shoot me a message or put a comment on this video. Had a great time researching all this, learning more about, you know, these examinations in detail, and I look forward to helping you guys as best I can with preparing and passing your boards. I hope you have a good night. All right, bye.